I'm Ming-Ka and my pronouns are she and her. I'm a Chinese immigrant who's grateful to be a guest on Winnipeg, Manitoba. So Manitoba is located on the treaty territories and ancestral lands of the Anishinaabe, Anishinaabe, Dakota Iote, Dene Sulene, and Nehennawuk nations. And it is also located on the homeland of the Red River Métis. And of course, northern Manitoba includes the lands of the Inuit. I am the co-lead for the health leadership theme for the Canadian Health Workforce Network, or CHWN. I am a pediatric clinician educator at the University of Manitoba. I support leadership education across the 5 health colleges. And I also have a role in anti-racism and social justice for the Department of Pediatrics.
I am Dee Taylor. I am coming to you from my home, which is in a rural community called Eagle Bay, which is along the Shuswap Lake in the interior of BC in the unceded ancestral territory of the Secwepemc peoples. I have a couple of hats and roles in this, and one is as corporate director of research for interior health. I'm also one of 2 scientific directors for the Rural Coordination Centre of BC. I am the senior research advisor for the Canadian Health Leadership Network, and along with Ming-Ka, I'm the co-lead for this leadership theme.
Having this as part of a theme really allows us to think about how we can partner across different organizations. The CHLNet and CHWN, as a couple of examples, really allows us to co-create and grow and consolidate the network. And I think that it really, given the academic nature of CHWN, it really helps us to think about the importance of evidence and how we can accelerate to a systems level.
This theme is really important in thinking about leadership as an action, integrating that learning health systems thinking. And leadership is so vital. And I think now more than ever is the time for leadership to be pulled out from something that we think we do in the background, but really examine it, push it forward, and see how we can use it to develop stronger relationships within our network of leaders.
You know, for me, it's interesting. I mentioned the thriving, and I got into leadership education actually of learners, first within medicine residents, really thinking about how we can support them thrive in their different environments. Through that, I guess, lens, I would say that it really became apparent that, you know, addressing equity, addressing racism and oppression so that everyone felt welcomed was really an important facet. Along those, I think the issues around sustainability and planetary health also became important. And so it's been interesting to reflect on how I've reframed leadership and its importance, and looking for threads in which we could partner and collaborate on, such as the Okanagan Charter, in terms of moving this work forward.
For me, the journey around leadership in health systems specifically, I've always been so curious about how people are together and the impact on patient care, and that how in that very relational sense. And leadership has such a massive role in allowing for good relationships and the how of how people in the health system work together. That really does lead into good quality of care for patients and communities. How that is also reciprocal for the leaders and the people themselves, so that it becomes about good quality patient care, but it also becomes around good working environments for people in the system and for leaders.
You know, we mentioned the need for co-creation and partnership. So networks like CHWN and CHLNet are incredibly important to really gather diverse perspectives and really think about how we can be a learning community.
CHWN is that network piece. So it's relational, building those relationships to the point where you can share information quickly. You can be open and authentic about what you're dealing with in the system that might be a problem. There might be solutions that you have access to through this network that you wouldn't have had before.